Day or just the class?
Introduction.
Sure, sure.
Namaste. This is Yashasvika from PANCHAJANYA, Ahilya Bhai. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our mind, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality, but also as a way of life. All these while walking in the path of Dharma. Hence the motto, Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need of spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharatarashtra, and values to all Shastra of people in every corner of the world. Also, the founders, being Ayurveda aspirants, know the inside out of today's medical field. Hence, they aim to make people aware of this and also try their best to solve this on the go. This is an organization that is created by 28 young, energetic individuals of the 21st century, where all have left behind their differences, insecurities, and have come together united for the betterment of this great nation and its heritage as a whole. We at Panchajanya recognize each and every individual's true potential and make sure that they reach their maximum. Everyone who is a part of this family performs on their own will, but within the limits of service and contribution. When one becomes part of this organization, he or she will surely feel proud as and honored when carrying out the activities. Our main goal is to reach every individual in creating awareness of our ancient knowledge and wisdom, its efficacy in the modern era, and linked with the current ongoing affairs, its revival, and most importantly, bringing everyone together in working. In order of these all to be achieved, we have set up various wings with working principles and objectives. They are Ahilya Bai Wing, Swami Vivekananda Wing, Karnata Bala Wing, Govardhana Wing, Ashwini's Wing, Narada Wing, Kautilya Wing, Vedavyasa Wing, Nalanda Wing, and Sanjaya Wing. Coming back to the members involved in our organization, we have doctors, healthcare workers, teachers, students, and people from almost every single occupation available, aiming at working together and bringing forward the true essence of Bharat and her traditions. So, all those who fit under these categories are welcome with honor and privilege. Today, with us, we have Dr. Arya Subhash ma'am. Ma'am has did her undergraduation from SDM Institute of Ayurveda, Hassan, post-graduation in Agadatantra from SDM College, Hassan. Ma'am is presently working as Assistant Professor, Department of Agadatantra in SDM College of Ayurveda and Hospital, Hassan since 2020. She has a dissertation work as an analytical study on the effectiveness of Shigru Bija in Jala Shuddhikarana. She has presented more than 8 oral paper presentations and more than 7 national and international publications. We welcome you, ma'am. Over to you, ma'am.
Thank you, Team Panchajanya. Am I audible?
Yes, ma'am, yes.
Okay, now we will start with syllabus number 14 and 15 of the syllabus. Actually, it contains multiple topics and it's quite a long, it contains a total of 123 slides. Now we will move to the first one. The first point, number 14, is maintenance of medical record. So what is basically a medical record? Whatever data you are having regarding a patient. It contains all the preliminary data of the patient along with the diagnosis, treatment, and the end results, whether we have got enough cure or not. All such things are maintained in the or mentioned in the medical record. So this itself implies that it's very important to maintain a medical record. And along with these things, it may be also containing different notes by the healthcare professionals, be the doctor, the PG, the nurse, whomever, the lab technicians, lab results, whatever is there, everything will be maintained inside a medical record. So we'll see what the uses of a medical record are. First one is to document the patient illness regarding their further follow-up, the treatment given. And this is basically a communicative letter between the attending doctor and any other healthcare professional who will be wanting to know regarding the patient. Also, this can be used as a document in order to safeguard the physician and surgeon for any illicit or alleged complaint which is filed against a doctor by the patient. So we'll see what medical negligence is. In such cases also, this can be this can be working as an evidence. And also for teaching postgraduates and undergraduates, collection of health statistics. This is used as a standard data for collecting or doing an epidemiological kind of study. Also, this can be used as a evidence in legal matters and court cases, and also for insurance cases. You might have seen patients coming to claim for insurance by using their medical records. So what the importance of this medical record is, it gives an idea of how much professional care was given to the patient by the doctor and also from the side of institution. We have it of three types: inpatient record, outpatient record, and emergency record. Now, these are some of the components which are contained in a medical record. You can see, starting from the patient information, the medical history, physical examination, consent, that one is important, till the discharge summary, everything is included inside a medical record. So imagine now you are having multiple medical records in your hand. You need to identify first which is pertaining to which patient. So labeling is a very important thing in it. We will be giving the patient's name, medical record number, and the year of last attendance. That is the label we are going to put in the exterior so that we can identify it easily. It also contains a number. Either it can be digital number, which can be like the 1, 2, 3 subsequent numbers what we are going to put, or it can be also automatically computer generated OPD or IPD numbers. Now we will see what happens when a patient record is got to the hospital. Like once a patient is discharged, the nursing unit are the people who are responsible to take the medical record. After that, they'll be preparing a list on how much ever patients were present in the ward, and they will be segregating this. They will be checking the records, whether all the data are present inside it, and finally they will be sorting. Suppose if the patient is dead, then the medical record should be going for the registration of the death, such cases, or if he is live, this should go for the future treatments. So this is how the patient record receipt and after how it is stored. Now, how do we retrieve a patient record? Suppose if we need to get any details from it, first the patient or whomsoever is in need, maybe the doctor needs to get any particular information from the record, he need to fill a retrieve form. This is given to the RMO. This needs to be get approval from the medical superintendent. And finally, the RMO will be giving you the records in duplicate, and the duplicate will be saved. Original, if for example you have to produce this in the court, you are being the patient there, then the original will be given to you and the duplicate will be saved along with the number of pages and all. Why it is so important? Because this, once if it is misplaced, then it can be like the patient can sue you in the court of law. Now we will see, in case of a medical legal case, how the information or these kinds of you are going to ask a data in case of a medical legal case. For example, a road traffic accident case, how it should be given to the patient. First is, we will be getting a request from the lawyer in order to produce this in the court of law. RMO should be recording and registering whatever, like so and so a person has asked on this date at this time regarding producing of this record in the court of law. And finally, she will be checking the patient's whatever preliminary data are there with what is asked and what is already there in the system. And then they will be needing a signature from the attending doctor regarding, okay, I am going to give this to the court of law or something like that. Then the RMO will be writing a request letter. Along with this letter, along with the reports and a copy of the document will be given, so that the RMO will be finally notifying the hospital administration after this particular either record is being handed over. She or he needs to inform the hospital that it has been handed over, so that we have a standard record of what has been happened to the record of the patient. Now we are going to give a medical record for the court of law, so that you need to get a summons from the court. Summons is something like you are the court has asked to present you as a witness or to produce an evidence. So you will be receiving a summons. Then the RMO will be recording all the details of it. Then he or she notifies the doctor and hospital administration regarding we have received a summons in so and so case. So then she'll be checking all the records. As we have said previously, duplicate will be kept. And if the original is being given to be produced in the court of law, finally, when the patient is coming and going to give you back, then she needs to dispose of the duplicate. The duplicate also should be treated with much care, like how you are going to treat an original one. Now, why this may be important? The quality policy is like medical records, whatever documents are there, everything should be treated with confidentiality. It should be placed in a secure place, authenticated. We'll be knowing how we'll be taking care of all our health reports. The same way it should be maintained. And main aim is like if a patient is coming and asking you, your aim should be like within minutes of request, you must be able to provide it. That is also coming under the quality policy. Innondu, to provide timely intimation of birth and death to the particular board. Why? Because if imagine a patient has died today and you are going to register it after 7 days, it will be of no use. So timely it should be done. And also to provide timely intimation on infectious and notifiable diseases, so that there may be some diseases which were already eradicated from the earth, but what if you got a new case of it, like a 10 number of cases you got in it, you need to notify the board regarding, okay, this disease is coming back, so that we need to alert our team regarding this. So these are coming under the quality policy. And now, how much should you hold a medical record? Save how much do you, how much time you are supposed to retain the medical record? In case of an OPD, the minimum is said to be 5 years, and IPD for 10 years. But as per the Medical Council of India, 3 years from the beginning of treatment is the time when till what you need to maintain the medical record of a patient. In MLC cases, it is like 30 years. Why? Because we don't know when the case may be reopened again. And once if the patient come and ask you, you are supposed to produce him the record maximum within a time of 72 hours of request. So this was the 14th point. Now coming to the 15th syllabus point, and the first one, that is physician's responsibility in criminal matters. So from now on, you imagine yourself in this position and then you listen to this so that you'll be understanding it better. You are a person who has a client or a patient involved in a criminal matter. So your idea will be basically to go to the crime scene or to collect maximum information and to gain first-hand knowledge of all the vital and circumstantial evidences, whatever is happening. And also, you are the person who are supposed to give maximum idea to the patient regarding, maximum idea to the team working under you regarding the fact. So you should minimize the misinterpretation of the fact. Innondu, whatever is needed to be collected as an evidence, only that is needed to be collected. Innondu, you are the person who will be standing as a source, or you will be providing the idea to interact between various experts who all are involved in the medico legal case. Next, innondu, suppose if you are being called to produce as a witness, you are supposed to go there as an expert witness. You are supposed to produce all the documents when you are going to the court, and also you are supposed to handle it in with proper precautions, so that you have taken today this evidence and tomorrow it should not be mishandled. And another one more thing which comes under your duty is you are supposed to communicate regarding all the data, whatever has happened regarding the case, to the police officer under section 39 of CRPC, Criminal Procedure Code. And till previously, we were the attempting to commit suicide was also as considered as a serious case, and it was mandatory to report that to the police. But an amendment has happened. From there, it is already told that already a suiciding attempt patient is already, he will be like under mental stress. You're not supposed to, once he survives, you are not supposed to go to give him any sorts of punishment. So it is under 309 of IPC section. It is told it is not mandatory for private practice to inform the police, but if he happens to die after your treatment or after your care, whatever you are giving, then you have to inform the doctor. Under 175 section of CRPC, doctor has to provide all the information regarding a case for a police or a magistrate. If he is concealing it, he will be punishable under section 202 of IPC. And if he is trying to distract the evidence, again 201 IPC will be punishing him. Now, he is also supposed to preserve the trace evidences, whatever he is getting, preservation of record, evidences, everything. And whenever a police is asking, he has to hand it over to the police. Thus, we finished the first point of responsibility of a physician in criminal matter. Next is one important thing called medical negligence. You being a doctor, you are committing harm to a patient. Imagine that case and then listen to this. So synonymously, it is also called as malpractice. So as the definition says, it is a lack of want of reasonable degree of care and skill or willful negligence on the part of medical practitioner while treating a patient. While treating a patient is very important, resulting in bodily injury, ill health, or death. So how do we understand? The doctor here has not provided enough care and skill to the patient. It is like you are comparing yourself, or other people, or the council will be comparing you being a doctor to the other doctors of the same profession. If you are not providing the skill which any other doctor of your profession and in the same ranking can provide, then you are suable. So we have it of two types, act of omission and act of commission. If you are supposed to do any act or any treatment modality to a patient, which any doctor would do, but you are not doing it, that comes under act of omission. You just omitted to do it. Act of commission is like you are wantingly doing something by knowing that these may be causing some side effects to the patient. Examples we'll be seeing in the next slides. So basically, it is classified into two, civil and criminal negligence. As usual, civil negligence is comparatively of lesser degree of punishment when compared to criminal. So whenever a doctor is doing something, a civil wrong, it is called as a tort. Not only a doctor, anybody doing it can be called as a tort. Remember this term. So whenever a civil case has happened, it might not have taken away the life of the patient. So what we need is monetary compensation for the damages, as equated to that will be payable by the doctor. So this will be trialed in a civil court or consumer redressal form, and the case has to be filed within 3 years of happening of the offense. So we have one more term called res judicata. It means that whenever we have filed a case in a lower court, and if we have got a particular solution from the court, but we are not happy with the court, then we will be going to the higher. But in this case, we don't have such a provision. Whatever decision you have once got is the final. That is called res judicata. So here the burden of proof, who needs to prove that such a negligence has happened, it lies in the plaintiff, means the patient. The sufferer here will be the patient. So we have 4 D's to remember here. First one is called duty of care, dereliction of duty, direct causation, and damage. We'll see them one by one. Duty of care is that you need the patient. Now imagine you are the patient. You need to prove that there was a doctor-patient relationship, which starts only if the doctor accepts you as a patient and starts a treatment. So once this relationship is not there, then the doctor is not chargeable. Only after accepting a patient it is done. So you need to prove first that your doctor had a particular duty of care to you, which was not done. Next one is dereliction of duty. That is failure on the part of the doctor to provide whatever was supposed to be given. For this, it comes act of commission. Example is operating a patient under the influence of alcohol. You being the surgeon have drunk alcohol and then you have gone for a surgery. What you have seen in Arjun Reddy movie. You're not supposed to do that. You have done this by knowing all the possible negative outcomes of it. So wantedly you have done, called act of commission. Act of omission is like you did not give enough proper post-OP care to the patient. What has happened? It has led to infection and thereby the death. So that is dereliction of duty. Because of the dereliction of duty, it has caused some causes has happened and direct damages has happened. So the patient here needs to prove that due to the breach of duty by the doctor, he has suffered this harm. So whatever dereliction of duty, the duty which was not committed properly has happened, is directly equatable to the damage that has been caused. The damage can be any injury, harm, disability, or even death of the patient. But in case of civil, it never comes to the death. Now we are moving into criminal negligence. Here, if the patient is alive, he comes or his relatives will be coming. Criminal court, it is trialed under criminal court and prosecuted by police. In the previous, it was in civil court or consumer redressal forum. So there should be a gross negligence act that has happened. Either it has caused the death or severe harm to the patient so that he may not be able to perform his daily activities, which could not have happened by the act of the doctor. So this is a criminal offense and it goes beyond the range of compensation. Example is you had to operate the left limb while the doctor has operated on the right limb, removal of a wrong organ, wrong blood transfusion, leaving instruments in the abdomen, criminal abortion. All these can be considered as examples of criminal negligence. Next point is doctrine of res ipsa loquitur. In case of criminal negligence, the burden of proof, the person who has to prove it is the doctor himself, that I have not done something like that. Why? Because your name will be permanently or temporarily erased from the register. That is a possibility. Or even you can, permanently you can lose your job. Now we have a phenomenon called doctrine of res ipsa loquitur. It says that the case, thing, or fact speak for itself. Like even we are able to see the fact. Example, instead of the left limb, you have operated the right limb. It is evident. Even though you have done all the operating procedures pakka properly, the thing mainly itself, you have done a mistake there. So it speaks for itself. One more example is prescribing overdose carelessly, thereby producing the ill effect. It will be visible from the patient's symptoms itself. So both civil and criminal can come under this. Conditions to prove it are: there will not be any contribution from the side of the patient. Doctor will be solely responsible for it. And also he needs to prove that in the absence of negligence, I would not have suffered the injury. Thereby, we finished another thing called medical negligence. Now we will see medico-legal aspect of AIDS. While remembering or while hearing the term AIDS itself, we will be remembering some taboo. We will be having a concept of taboo that we are not supposed to speak to those kind of patients or not. Remember, you are a doctor. If you are thinking like that, that all comes under unethical practice and you are guilty there. So once the doctor is going to treat a patient of AIDS, we need to have through what all measures he can be infected with this HIV. So the samples are blood, semen, vaginal secretion, breast milk, cerebrospinal fluid, peritoneal fluid, amniotic fluid, pericardial, synovial fluid. All these we should have an idea through which the infection can be transmitted to us. So we need an HIV testing policy which contains of 3 types: compulsory testing, mandatory testing, and voluntary testing. Now, whenever we are testing a patient, we are supposed to maintain it under complete confidentiality. Innondu, we are not supposed to disclose the patient's identification to anybody who is there. Like, just we are not supposed to have loose talks. You see, this patient is HIV. No, doctors are not supposed to do that. Then, what is the purpose of this HIV surveillance? We are supposed to give a report or record of to the state registry so that they have an idea on what is this particular number of patients prevailing in that area of HIV, whereby new health activities can be coordinated. Now we will see healthcare workers and the risk of HIV infection. So first point is, no individual can undergo mandatory testing for HIV. And nobody, we are not supposed to impose it on them. Even during we are going to a new firm, you are going to join a new firm, they can ask you for all blood tests except HIV or such related test. Then, or if at all you are suffered from HIV, you have equal rights to education and also for employment as that of any other person. Now coming to the legal aspect, under section 269 of IPC, it says that if a patient is knowing that he is having AIDS, he knowingly marries or have a sexual intercourse with a normal person, thereby transmitting it to that person also, then he is supposed to be imprisoned for a period of 6 months with or without fine. And also another section 270C IPC also says imprisonment for 2 years with or without fine. These two, among these are chosen based on the severity of the incident. And in section 302 and 299 of IPC says, if a person intentionally has sexual intercourse in order to infect the other person, he is liable to be punished. Then 304A says that if a blood bank is supplying infected blood, which will be leading to death of the patient who has transfused blood, then they are supposed to be punished. Now coming to the next aspect called AIDS and autopsy. We know that autopsy table is a place which will be highly unhygienic, and you have the possibility of transmission of all sorts of infections there. So they are under high risk. So viable HIV virus will be living inside or around in the environment for up to 21 hours, 14 days, or it can be seen in the vitreous humor for up to 34 hours. So screening the patients or the dead body before autopsy will be practically impossible. So better what we do, we can adopt some universal precautions. So we'll see what those are. Staff transporting the body of an HIV patient is supposed to wear protective clothing. We call it as AIDS suit, which I have included the image on the next slide, which includes disposable scrub, plastic apron, rubber gloves, cap, face mask, goggles, and shoe covering. Now, whoever transports the body to mortuary, while doing that, you are supposed to plug all the orifices with cotton so that you won't be having contact with any form of fluids of the body. You are supposed to avoid sharp weapon cuts, and also you are supposed to use vacuum, dust, exhaust, and filter. For example, you are sawing the bone. You are not supposed to have these kind of aerosols around in the air. These things can be while you are inhaling, or if it is not like inhaling, if it comes in contact to your bloodstream, you will be getting the infection. So this is what a suit, that AIDS suit, looks like. Now, whatever specimens you are going to collect from the body, you have to collect in a leak-proof container. After the autopsy, wrap the body in a polythene sheet. Instruct the relatives also to be cautious while handling the body, while you are handing over the body. Next, disposable and used sharp instruments are supposed to be kept in puncture-proof container. Usable instruments are supposed to be autoclave, and disposable materials as per the biomedical waste management rules. So you have it of different colored waste bins. So you are supposed to waste plastic sheet, this one covers are there, you are supposed to dispose it off clearly. Okay, next one is the autopsy table, wall, roof, everything you are supposed to disinfect with sodium hypochlorite solution. So these were all included under the universal precautions. Once more we will see. The entry to the lab or work area is restricted only to trained people who are specially trained for handling these kind of infectious materials. They are only supposed to enter. Biohazard, no admission sign, you are supposed to hang on the door of the mortuary while you are doing the autopsy of an AIDS patient. We have seen what all you are supposed to do on handling of sharp instruments and how the disposal of used instruments to be done. And a worker, if there is a worker with a skin lesion, he should be avoided from the work till the procedure finishes. Now, and the surface also you are supposed to clean after the procedure. Thereby we have ended another one topic. Now we are moving to rights of an unborn child. So we will be thinking, anyway the child is not born, then what right does he or she has? Now we will see, since the unborn child is also considered as a human being, they are entitled to have certain rights. The first one is right of life. So that is why we say fetal homicide is going to be a crime. Section 30 of Transfer of Property Act says that a baby inside the mother's womb is equally having the right to get the property from his parent as that of a live child. Next one is Section 416 of CRPC says, suppose a woman is trialed and death sentence is being given to her, and then if she is found to be pregnant, either the death sentence will be postponed till the delivery finishes, or it can be converted into life imprisonment depending on the severity of the case. Section 20 of Hindu Succession Act, it says that the born child and the baby in the mother's womb has equal status and right to inherit the property of the deceased parent. Section birth or cause the death of a fetus, he will be liable to be punished. Article 25(2) of Universal Declaration of Human Rights, it says that motherhood and childhood, they need to be treated with special care, protection and assistance. 3.1 Principle 2 of United Nations Declaration of the Rights of Child states that every child has the right to be born, also treated physically, mentally, morally, spiritually and socially in a normal and healthy manner with freedom and dignity. Article 6.1 of United Nations Convention says that every child has the inherent right to life. You are not supposed to kill. Next one is 1978 American Convention on Human Rights has said that every person has the right to his life, right to have his life respected, and this starts from the time of conception. Thereby we finished another point. Next one is Medical Termination of Pregnancy Act 1971. Whenever you are remembering an act, remember the year. That is very important. So we will see from the term itself, we will be able to understand. The first aim is to provide to improve the maternal health scenario. Why? Because whenever an unsafe abortion is happening, there can be the maternal mortality and morbidity will be a lot. So in order to improve that condition, legalize abortion services, promote access to safe abortion services to women, and also it offers protection to medical practitioners who otherwise would be penalized, which says that suppose if the mother is not having any problem but the baby has died already, or there will be stillborn births. You might have seen people who will be manhandling the doctor and all. And in that case, these kind of under the act, if anything like a chromosomal abnormality was there to the baby, and that is the reason why it has died. So we have provisions in order to safeguard the doctor involved here. Coming to the legal framework, first we had the MTP Act. It says that it has certain rules and regulations which the central and state government has powered, and it says when and where the pregnancies can be terminated. Then MTP rules and regulations, it says different rules in order to terminate the pregnancy. It also trains where these kind of abortions can be done, and also where and all we are supposed to do, which are the kind of people who are supposed to do, all those are mentioned. Now we will see legal abortions. What are legal abortions? Only if the termination is done under the conditions specified by the Act, done by the medical practitioners who, as per what the condition is prescribed in the act, and in a place that is approved by the government as per the act, only then it is a legal abortion. Now we will see different indications for an abortion. We have therapeutic, eugenic, social, humanitarian, and environmental causes. First, therapeutic indication is to prevent any injury to the pregnant. For example, if she has an episode of epilepsy, she will be at high risk. So that is a therapeutic indication to terminate the pregnancy. Eugenic is if there is any risk of child being born with physical or mental abnormalities. Social is to prevent the physical and mental trauma to the lady. For example, in case of unplanned pregnancy, this may be negatively affecting the physical and mental status of the mother and also for the baby. Humanitarian, for example, in case of rape, if the lady is becoming pregnant, you have the provision to terminate the pregnancy. Environmental, suppose if she is not getting any help from the surroundings or she is in an unsafe living, but only after providing the required data to prove this. Now, maintenance of register, you are supposed to maintain these details for up to 5 years, and also you are supposed to maintain it with proper professional secrecy. Privileged communication is like only if you are supposed or you are asked by a particular authority like a court or the higher police officials or even the higher authorities, then only you are supposed to speak it to them or supposed to disclose this case actually. Now we will see emergency, any RMP can be performing it. We will see what are the conditions otherwise. So consent of a woman is mandatory to do this. And if she is a minor, for example, if a rape, she was attempted for a rape and all, and thus she has become pregnant, guardian should be giving the consent. For a husband's consent, it is not necessary. Now we will see this differences. MTP Act 1971 was the first one, which was later amended on 2020. We'll see what the differences are. As per 1971, it is like up to 12 weeks or 12 to 20 weeks. If you are to suppose to terminate pregnancy, you have to take the advice of only one doctor. That is the same in both amendment and also in 1971. Next, in after 20 weeks or more than 24 weeks, they did not allow for termination in case of 1971. But in 2020, in 20 to 24 weeks pregnancy, you can take the opinion from 2 doctors and then proceed with the termination. More than 24 weeks, you are supposed to have the opinion of a medical board completely. And also you need to prove that there has a chance of fetal anomalies. And if the case is of emergency, then you can do it at any time in order to save the life of pregnant woman. One doctor is only enough for that. You need to remember this slide also. Now we will see different methods of abortion that are mentioned. In first and second trimester, it is mentioned. First, we have medical, like mifepristone, misoprostol, and all can be used. Surgically also, manually, we can aspirate through vacuum aspiration. The contents of conception can be aspirated. Dilatation and evacuation, suction evacuation, curettage are all some of the methods. In second trimester, it will be growing a little more, right? So there you will be going for dilatation and evacuation. Intrauterine, you will be instilling hyperosmotic solution, for example, saline solution, soap solution, and all. Thereby, you create irritation to the fetus, and thus it comes out of the system. Prostaglandins, oxytocin infusion, all has been everything can be done in the second trimester. There are certain contraventions to these rules also. Suppose if a doctor is doing a termination of pregnancy which does not suit to whatever tables you have seen just now, he is supposed to be or liable to be imprisoned for a period of 2 to 7 years. And if he is a government servant, he can even face disciplinary action or for dismissal from the service is also possible. Now we will see MTP Act Amendment of 2021. There we have already seen indications which if a contraceptive failure has happened, you don't want the baby now. As per 1971, it was applicable to only married women. But in 2021, even unmarried women can also be fit under this. Gestational age in 1971, it was only 20 weeks was for the indication. We have seen in the previous table. But in MTP amendment, we have seen 24 weeks and beyond is possible. Medical practitioner, we have seen how many are required. In 1971, 1 RMP till 12 weeks and 2 RMPs till 20 weeks. We have seen these differences. Next, one more important thing is if you are breaching the confidentiality, like you are exposing this lady or you are simply having loose talk about this lady to other doctors, making fun of her, or like basically like you are just speaking something, blabbering something which you are not supposed to speak about this lady, you are liable to be fined or imprisonment for up to 1 year. We'll see what are the different offenses and penalties. So if termination of pregnancy is done by a person who is not a registered medical practitioner, you are liable to be punished for 2 to 7 years with or without fine. And if you are conducting an MTP in an unapproved place, then also you are supposed to be with or without fine for 2 to 7 years. If a person willfully, like you are simply blabbering something about this lady in front of others, you are breaching the confidentiality there, you can have a penalty of minimum 1,000 rupees. Next, we will see what are the different complications that are mentioned of these kind of MTPs under the Act. We can have immediate or remote complication. Immediate are like injury to the cervix, uterine perforation due to the dilatation and curettage, hemorrhage and shock can happen, thrombosis, embolism. All these can happen at the table itself. Next, coming to remote problems. It includes gynecological and obs problems. You just go through it. All these are Prasuti point of view. There we have finished one more point. Next is the Transplantation of Human Organ Act 1994. So this act is mainly, it provides the regulation for removal, storage and transportation of human organs for therapeutic purposes and for prevention of commercial dealing. We know that there exists an organ mafia. So in order to avoid all the problems that are going to be caused because of these kind of mafias, such an act has been established in 1994. So we have 7 chapters and 25 sections under this. We'll see what each one is. First one is legal framework. Okay, so this bill was introduced in 1992, which was agreed by the president in 1994. Later, it got the name as Transplantation of Human Organ Act 1994. We'll see which all organs can be transplanted as per this: heart, kidney, lungs, liver, pancreas, intestine, thymus, and another one more section called the tissues, which can include bones, tendons, cornea, skin, heart, valves, and veins. Kidneys are the most widely transplanted organs, followed by liver and then the heart. So suppose if a patient is dying naturally, the donatable organs to be taken immediately are cornea, bones, skin, and blood vessels. Suppose if brainstem death has happened, like we have dealt this already in my previous class, what is brainstem death? Just go through it. We have a variety of 37 different organs and tissues which can be donated. We'll see what each chapter contains. First one is preliminary. So in that we have different definitions of what is brainstem death, and next one, what is a donor. This one is important for us. Donor is anybody who has voluntarily given the authorization. Okay, like you can take my organ like that, and voluntary authorization can be given by him, and he should not be less than 18 years of age. Next, we also have definition of what a human organ is. Next, chapter 2 contains authority for removal of human organs. Only the donor who is more than or equal to 18 years of age. And if any donor has already given in writing, in presence of 2 or more witnesses, that after my death, I am going to donate my organ, yes. Then even though if these witnesses are not present, once the document is already there, then anybody handling, or the relative handling the dead body is supposed to leave the body for transplantation. And when no such authority is there, the patient who is lawfully in possession of the dead body also can give valid consent for taking the organs of the person. Next one, so how many people you need in order to do this act? The patient, if you are supposed to donate an organ, patient or the body from you are supposed to take, then you need the certification from these many number of people. First one is a doctor who is in charge of the hospital where the brain death has occurred. Then a specialist in the field, a neurologist or neurosurgeon, and also the doctor who has been treating the patient. So we have 2 conditions where removal of, because from all dead bodies, we are not going to collect the organs, right? So in which all cases we are not supposed to collect that is, first one, suppose if there is any inquest, a criminal or civil kind of any inquest is pending on the body, you are not supposed to donate the organs. And somebody has entrusted, okay, my body is not supposed to be organ donated, it is supposed to be cremated in this and this way, you can't take the organ from such a body also. So what happens in case of unclaimed bodies in what you are getting from a hospital or a prison? If nobody is coming to claim the body within 48 hours of the death and 48 hours of receival of the body, or the time of death which has been time since death which has been estimated, then whoever is the management or the employee who is in charge of the firm can donate the body. And if you have an idea that, okay, somebody is going to come to claim this body after 48 hours, you are not supposed to proceed with it. And it will be always done by a registered medical practitioner. Now we will see, we have some restrictions on removal and transplantation. It's like before the death, you are not supposed to take these organs, that is already known, but we can do this under one provision. If you are going to donate your organ to your near relative, these are the near relatives, your father, mother, son, daughter, brother, sister, or spouse. To these people, okay, you can donate the organs without your death also. Now coming to chapter 3, regulation of hospitals. So whatever hospitals are not registered under this act or at an unregistered place, you can't go for an organ transplantation. But if it is for a therapeutic purpose, the doctor immediately can do a transplantation or remove the tissues from the eyes and ears of the person. That is an exemption included under miscellaneous. Now we will see chapter 4. It includes appropriate authority. Central government, which they will be appointing one or more officers and give them authority to do or frame the legal framework for this. Central government will be giving one from each union territory. Also, they also will be given the right to do these kind of activities. Now we will see what the functions of these authorities are. They grant or renew the registration of the places in which these kind of Transplantation Act, or also the medical practitioners who can conduct these kind of things. They can also suspend or cancel registration in case of any discrepancies. To enforce standards for hospitals and how a tissue bank, what are its parameters to be called as a tissue bank, where it should be storing, all those things are also looked by these kind of authorities. To inspect hospitals periodically in order for the quality control check, and to investigate any complaint that has been received. For example, you received a complaint on organ mafia. These are the people who will be initiating the investigation. Chapter 5 is registration of hospitals. So any hospital which is not registered under this act is not supposed to conduct an organ transplantation. You can't go to all hospitals and then write and give or sign a contract for organ transplantation. Now, no hospital shall be registered under this act under it is having all the authorities satisfied. It should have all the specialized services, facilities, skilled manpower and equipment, and maintain these kind of standards. Only then they are supposed to conduct the transplantation purpose. No tissue bank can be involved in this act unless it is specified as per the act. Coming to chapter 6 of offences and penalties, punishment for removal of human organ without an authority. You are liable to be imprisoned for 5 years with a fine up to 10,000. And you are doing this for the second time, then it can be a period of 2 years along with your removal of name. All those things can happen. Commercial dealings in human organ is nothing but mafia. If it is found that you being a doctor is involved in this, you can be liable to imprisonment for a term of 2 to 7 years with a fine of 10 to 20,000. But nowadays it has increased more than this particular range of money. Coming to chapter 7 of under miscellaneous, where we have already seen that eardrums, earbones and eyes can be removed by a registered medical practitioner if it is an emergency and the place is not specified under this act, but only provided it is only under the emergency. Coming to the duties of a registered medical practitioner. In case of live body donation, the doctor should satisfy that donor has given his authorization letter. He should be having an authorization letter only, after which he is supposed to take. The doctor is supposed to take care of these kind of things. Donor is in a proper state of health and fit to donate an organ. You can't just randomly go and take organs from every dead body or any kind of death. Donor is a near relative of the recipient and sign a certificate after carrying out the test. Test under it includes basically serological test. In case of cadaver donation, you are donating a dead body. Doctor should satisfy that the patient or the donor has authorized to donate his body before his death, and the person who is lawfully in possession of the dead body. For example, if you have died, your guardian or your spouse will be in lawful possession. He should be able to sign the certificate for donating your body. A doctor, before removing the organ from a brainstem dead person, needs to certify first that he is a brainstem dead patient, and also in case of patients who's less than 18 years, we need to sign a certificate from the guardian. We'll see what are the penalties. Removal of human organ without an authority, up to 10 years you can be imprisonment with a fine of up to 20 lakh. Up to 20 lakh is like, it starts from basic to 20 lakhs. Removal of human tissue without an authority, there also for the second time you can be, or for the first time you can be like up to 3 years with a fine of up to 5 lakhs. Live unrelated organ donation, and you are producing some false documents, you can be imprisonment from 5 to 10 years. From 20 lakhs to 1 crore you may be liable to pay. We will see which are the different times for different organ transplantation. So you can see these many organs can be stored. This also implies that these many organs can be stored for a maximum of this time. You can see the lungs can be only stored for about 4 to 6 hours, within which you are supposed to transplant it, while the heart valves can be stored for a period of 10 years even. Now we will see how do you match between the donor and the recipient based on your blood type, body size, how sick the patient was at the time of death, or the donor or the recipient is at the time, like if he is going to an imminent death and an organ transplantation could save him. All this will be seeing in the list, and thereby they'll be creating a waiting list as what you are seeing in the image. Donor distance from the recipient, tissue type, and time on the waiting list. This is the basis they will be matching. So how do you preserve an organ? Just before removing an organ, just after removing an organ, every organ will be, the blood will be removed completely by flushing it by an ice cold solution which contains electrolytes and other nutrients. And also then these organs are placed in sterile containers packed with wet ice, and then it is being transferred from the donor to the recipient as quickly as possible. There we have finished one more act. Next one is Preconception and Prenatal Diagnostic Techniques Act 1994, which is also called PCPNDT. At first it was called PNDT only. Okay, so basically prenatal, why do you go to diagnose the sex of a baby? In India, the prevalent thing is called female feticide, killing of female babies unnecessarily inside the womb itself. Okay, so this kind of sex selection, these kind of prenatal diagnostic techniques were all prevalent since many years. So first, this act was called as Prenatal Diagnostic Technique, adva PNDT. Later, it has been amended as PCPNDT. We'll see which are the prenatal diagnostic tests that are done. Very common one is USG, fetoscopy, sampling and analysis of amniotic fluid, chorionic villi, blood, or any tissue or any fluid. But what is the actual good motto of doing this is to detect if there are any genetic disorders, metabolic disorders, chromosomal abnormalities, congenital abnormalities, hemoglobinopathies, sex-linked disease, or inborn abnormalities to the anomalies to the baby. Only if it fits under any of these conditions, then the test is going to be positive. But if you are going to do something like a female feticide, then comes the negative aspect, the medico legal important aspect comes there. We'll see which are the places. So we have 3 different kinds of things to consider. First is genetic counseling center. There they give idea to the parents, counseling to the parents regarding, okay, these and these are the anomalies your baby is going to have. So it's better you can opt for another solution of MTP, which we have already seen. So a genetic counseling center means any institute, hospital, nursing home, or any place related to medicine where you are giving counseling to the parents. Next is genetic clinic, where you are going to conduct the prenatal diagnostic procedure, not the therapeutic, but the diagnostic procedure. Next is genetic laboratory, where you will be conducting analysis based on the genetic material that is received. Who all are the persons who will be completely included under this act? Are gynecologist, any registered medical practitioner. Being you itself, a patient has come to you, there you felt that they need to do this kind of diagnostic technique because of the chromosome abnormality of the baby. Yes, you are also involved under this. Pediatrician, lab technician, radiologist, sonologist, anybody can be included under this. Now we have certain points to remember. First is no doctor or any other person can cause or conduct these kind of diagnostic techniques other than a registered place. That is for sure. Next one is whenever you are doing an USG of such a lady, you are supposed to keep the medical record completely. You are supposed to do these tests only after explaining about the side effects and also after effects of the procedure. If you just go read some more, you'll get an idea even USG is going to have a side effect and after effect. And also next one is we need to have a written consent of the patient, and also she must first is like we are supposed to educate, make her aware of this procedure, and then only you are supposed to do this kind of procedures. Next is No person, either the relative or husband also, cannot be asking for these kind of doing, please can you do this kind of test, unless it is a medical reason. No person conducting the procedure shall communicate the sex of the fetus in any words, signs, or any other way, as we have prevailing incidence of female feticides. No person, organization, or clinic shall issue, publish, or communicate or advertisement. Anywhere you go outside, you might have seen like treatment for piles, fistula, and all, which is also not coming completely falling under ethical, but still you can't see any place where they are giving advertisement on like come determine the sex of your child. Nowhere you will be seeing those kind of like advertisements. Next is when to conduct. It can be done on a regular basis if the woman is pregnant and she is more than 35 years. She has undergone more than 2 spontaneous abortions. If she has a history, then okay, she is a very good indication of doing these kind of diagnostic tests. She has been exposed to potentially teratogenic agents. Her spouse has a family or herself has a family history of mental retardation or any kind of physical deformity. Then you can go for these kind of tests. We'll see what are the offenses. If anybody acts against this, 3 years of imprisonment with 10,000 rupees fine, and in subsequent ones, up to 5 years imprisonment with 5,000 fine. And in any medical procedures, to choose the sex of the child is done, up to 3 years and 50,000 fine. On subsequent, that is the next ones, it is up to 5 years and 1 lakh. If a doctor is reported in the state medical council, he can be suspended or even his name can be removed from the register. Thereby, we finish one more point. Next one is malingering of feigned disease. Imagine you have a test today at the first hour, like 9 to 10, you are having a test. What will you do at 8:30? You pretend that you are having a stomach ache or a headache. This is what is called malingering. You are pretending, you are just falsifying to do something. So imagine if you have done a crime, in order to conceal the crime, you will be going to feign a disease. Feign andre nothing but you will be fabricating. So it is intentional production of false or grossly exaggerated physical or psychological symptoms motivated by external incentives. You did not want to write today's exam. That is the reason why you have done this. That was your motive there. So sometimes it can be psychological cost also, under psychological cost also, to gain a reward or to avoid something. Sometimes it can be also a part of mood or personality disorder. So falsification we can see in what all cases. First thing is avoiding the work or responsibility, seeking drugs, avoiding trial. You were called by the court of law, you produce a medical certificate stating that you are sick, but you already know that you are guilty, so that you are producing these kind of things. Seeking attention, avoiding military services, leave from the school, paid leave from a job. These are all different examples. Now we will see which are the different symptoms shown. Suppose if imagine yourself, so that you are being involved with a civil or criminal legal action. Surely you will be acting, you are having one or the other thing today or tomorrow. Next is facing the possibility of military combat duty. You don't want to do it. There also you will be pretending. Not cooperating with a doctor's examination or recommendation. So you already know that you don't have any underlying pathology. Then how will you go and cooperate with the doctor? What if he finds out that you are completely okay? Then all the things that you are building up will be falling down. Next one is describing symptoms as being much more intense than what the doctor's examination reveals. He has examined you and found out that, okay, you are having a 10% of some these and these kind of things. But what if you are pretending to be, you are having the other 90%? So these are the different ways. Now we will see how do you diagnose this kind of thing. First one is through thorough physical examination. As it is psychology driven, open-ended interview can be helping. Open-ended andre, you don't have an end for it. You don't have a standard for it. You ask the questions till you take out the fact from the patient. Now, at follow-up to check the inconsistencies, you can follow up the patient. He has been saying that I am suffering from serious something like a cancer or something, that something is growing inside me. But on the first day of your examination and also on the follow-ups, you found that what he has been doing is simply piling up of false things. Then it comes under malingering. In lab investigations also, you can do to exclude like these and these. Okay, there is nothing existing in this patient, so he has been just malingering. This can also be understood. So how do you manage this? Either behavioral therapy, psychotherapy, or counseling can be done. What is the medico legal importance? We will see. So the patient has been demanding some kind of thing. He needs a leave. He cannot come and produce himself as a witness in the court of law today. So when he is being forced, what will happen? He will be getting aggressive. Thereby, it leads to a conflict. Though some people may be acting as if they are having some sort of mental illness at the time of happening of the crime. In movies, you might have seen they like the convicted has been saying to the judge that I'm having heart disease, so please don't ask me these kind of questions. Deafness, loss of voice, which you may be doing at your homes even. Then defect in vision, and this one is very important. In case of an injury, for example, bhallataka, you know that it is a highly irritating drug which contains highly irritating oil. So what if you apply some oil of it on some parts of your body, and later you go tomorrow and say that your friend has hit you, or this kind of a person has manhandled you? That is also possible, right? So these are coming under the medico-legal importance. Now we move into the next one called International Code of Medical Ethics for Doctors, WMA andre World Medical Association. So what is medical ethic? It is basically a code of conduct, how you will behaving to you with another doctor, you with another patient, and you to the state. Remember this thing called ethics. So it was adopted in the Third General Assembly of World Medical Association, London. And now we will see what are the different classifications it contains. First one is duties of physicians in general. Understand that you are a physician, so these are your legal duties. So you hear in that way. A physician shall always exercise his or her independent professional judgment and maintain the highest standards of professional conduct. Next one, he is supposed to respect a patient's right to accept or refuse a treatment. He can either come to you, okay, second visit, he can go away from you also. That is totally going to be fine. You are supposed to accept it in that way. Next one, he should not allow his or her judgment to be influenced by personal profit or unfair discrimination. You get maximum number of commissions from something. You are not supposed to simply refer this patient for that your personal benefit. He should be dedicated to providing competent medical service with full compassion and respect for human dignity. Yes, you are supposed to do it in that way. He should deal honestly with the patient's colleagues and also report to appropriate authorities as needed. He is not supposed to receive any financial benefits as incentives ugly or as commission for selling any particular drugs. For example, I'm saying he is supposed to respect the rights and preferences of patients, colleagues, and other health professionals. He is supposed to recognize his role in educating the public. For example, a patient comes to you during a corona time without a mask, not using a sanitizer. It's your responsibility to educate the public. Next is he can certify only what he is personally verified. You being a doctor, somebody has come to you and saying that I have extended my leave, I need a certification for my illness. Unless you have personally verified, please don't go to these kind of things. Then next one is a doctor is supposed to strive to use healthcare resources in the best way to fit the benefits of the patient and their community. And the doctor is supposed to seek appropriate care and attention if he or she suffers from mental or physical illness. And also he is supposed to respect the local and national code of ethics. Next, we will see what are the duties of physician to patients. Physician shall always bear in mind he is having the obligation to respect the human life that has come in front of him. He is supposed to act in the patient's best interest. He is supposed to act in the best interest. You have asked your patient to show some of like his private parts or something for examination to reveal those parts. Then if he is not willing to, you are not supposed to simply push him to it. Okay, that is your basic respect you are supposed to give to the patient. Next one is being a doctor to a patient, you owe or like you are owing the complete loyalty. And also if you are not able to take a case, please feel free to refer the case to higher centers. You are supposed to respect a patient's right to confidentiality. Like previous we have said, don't just go and have loose talks about the patient breaching his confidentiality to other doctors ugly, to other whatever health worker is possible. You are supposed to give emergency care. That is your humanitarian duty. And suppose in situations when he or she is acting for a third party, for example, a third party has come to you, then and has come to say that these I have come in behalf of this patient, and these are the things that she is facing now, please give me medicine for it. As an example, I have told you are supposed to have full knowledge of the situation before you are going to prescribe a medicine. Next, you are not supposed to enter into a sexual relationship with your patient or also to abuse or exploit that particular relation. Now we will see what are the duties of physician to colleagues. A physician shall, you may be having your colleague itself may be coming to you for treatment, or in general also how you are supposed to treat your colleague. When medically necessary, you are supposed to communicate all the aspects regarding a patient, but also by maintaining the proper confidentiality. And you are supposed to behave towards your colleague as how you expect them to behave. Same way you are supposed to behave to them. A physician shall not undermine the patient-physician relationship of colleagues in order to attract patient. It's like, suppose you are getting 10 patients a day. Your friend is getting 20 patients per day. So the 20 patients, your friend's one patient has come to you, and for their bad luck, that doctor also has come to you. You are not supposed to go to say to this patient that even your doctor is not taking care of himself, then why do you go to him? No, don't do these kind of things. There we finished another one more thing. Next point is Clinical Establishments Registration and Regulation Act of 2010. From the name itself, you can understand we have a set of rules and regulations given for how a clinical establishment is to be maintained. So it was passed by the Parliament on August 2010, and to prevent unqualified doctors, it was mainly done. Objectives are to prevent quackery by unqualified doctors. Why? Because now we have a registration system whereby that is why they have told that we are supposed to display our registration number in the board even, so that we can just take off the unqualified practitioners from the society. To establish a digital registry at the national, state and district level to improve quality of healthcare by providing minimum standards. Now we will see what are included under clinical establishments. It can be a government or a department of government. It can be a trust, whether a public or private one. Any corporations, which can be a government or non-government organization, corporations, any local authority or a single doctor, everybody can be coming under this clinical establishment. But we have an exception which says that armed forces are not coming under this, any armed forces establishment. We know that we have, for example, I'll say we have different criteria that a clinic should be containing these and these kind of things. These and these are the prescribed set of emergency medicines which it should contain. But we know in case of armed forces, we don't know from where and when the emergency comes. So there it is not applicable. First, we will see in state level, the district, we have something. State gives the, State gives the approval for performance or for functioning of a district registering authority. So this is set up by the state, where the district collector will be the chairperson, district health officer will be the convener, and there will be other three members. Powers and responsibilities are either to give provisional registration should be given to a practitioner within 10 days, or permanent registration. Issue any notice if you are seeing that particular clinical establishment is not having the condition met. Within 3 months of the finding this fact, you are supposed to issue a notice. They will be issuing a notice to enter and search any unregistered clinical establishments. And suppose if you are giving a notice, still you are finding the next day that it is still open and working, you can go for inspection, or they can come for inspection, inquiry, everything. And they can even cancel the registration or immediately restrain the person from any dangers that is coming. They can recover penalties and also maintain a register. We know that minimum required standards, they have set a particular set of standards, which I have just mentioned. You can go through if you need it in like elaboration. So they have certain standards for how much space a clinic should be containing, what all kind of human resource it should contain, what kind of furnitures and fixtures should be there, what are the essential equipments, and what are the emergency equipment and drugs. For all this, they have given different criteria. Now we will see if these kind of criteria which are mentioned under the Act are not met, surely there will be penalties. So running a clinical establishment without registration, you have started a clinical establishment, you don't have a registration now. Immediately after your BMS, you have gone with just your provisional registration or without even that. For the first attempt, you will have to pay 50,000. Second, it goes up to 2 lakhs, and in next attempt, it goes to 5 lakhs. Contravention of any other provisions. If you are running an emergency clinic, you don't have the basic set of medicines what is mentioned under this. First attempt 10,000, next 50,000, and in the final one, it can be going up to 5 lakhs. Whoever knowingly serves in an unregistered, you know that this thing is not registered, but for your practice, you have just gone to it. Like remember, you are liable to 25,000 of minimum fine. Any minor deficiencies which do not pose an imminent danger. You are not going to take the life of a patient, but you have worked in an unregistered clinic and there has been some mishaps happening. You are supposed to pay a fine of minimum of 10,000. There we finished. One more thing. Next one is Consumer Protection Act. So why or where does the word consumer fit under medicine? So we have a definition or which states who is a consumer. He is any individual or households that use goods and services generated within the economy. So you are basically paying for it. But we have another criteria also, without payment. That is also included. We'll see it later. So there also we have told there should be a doctor existing, then only you are fit or liable to be falling under the Consumer Protection Act. We have 8 rights that is set as for a consumer. Who is a consumer? Your patient here. So he has the right to safety, right to choose, right to have information, right to be heard, consumer education, redressal, satisfaction of basic needs, and healthy environment. These are the different 8 rights. So basic objectives is in order to give a speedy and simple redressal to the consumer disputes. You know that if you are going to file a case against something or some is happening in the court, you will be having multiple trials, so that the thing which you expected to get within a period of 3 months may extend up to 3 years. So in order to avoid all this, we have something called Consumer Redressal Forum. And also to protect the consumers at large from exploitation. Like we have a Consumer Redressal Forum. So the people who are providing the services will be having an idea that I am not supposed to do anything so that I fall prey to this kind, or like I can be suable under this act. Now we will see. First one, in case of doctor-patient contract. Whenever a patient is coming to you, it is always an implied consent is there. We have different consent. Implied andre, if he comes to you and if you are going to place a stethoscope on his body, you are not supposed to ask, shall I place the shall I check your BP? No. If he comes to your clinic, it is understood already. That comes under implied. So next one is expressed, where he will be giving you orally consent. Okay, please do this procedure on me. Next one, we also has expressed consent, where there will be written consent with duly signed and witness you will be giving. Now we will see what all inclusions are included under this Consumer Protection Act in case of medicine. So any services rendered by a doctor or hospital, like it can include consultation, diagnosis, investigation, treatment. Imagine you being a doctor is doing something wrong while doing the consulting the patient, or like diagnosis, investigation, or treatment. You are liable to be punished if the patient goes and files a complaint against you. If involvement of reimbursable charges, then also it is applicable. These may be like you are doing a particular health test and this money is going to be reimbursed to you later, but still, and there have been a mishap, even though you are getting back the money, still you can sue the doctor. If the services are given totally free, then you can't go and file a complaint against that particular doctor. It is applicable to patients who are treated free in paying hospitals where paying is required for any services. You are running a hospital where they need to pay for the service, but you know a patient like in person, so that you has waived off his charges. But still, if you are going to provide any negligence kind of thing, or whichever is not find suitable for him, you are liable to be punished. He can go to sue a case against you. Consumer does not have to provide any court or process fees in order to run the case. Settlement time is given within maximum 3 months. It should be even after with expert examination. For whatever reason, you will be getting the final decision. It is a 3-tier judiciary machinery. Basically, it has, we don't call it as court basically. We call it as redressal forum. It can be in district, state, or national level. We'll see what are the powers of these kind of consumer redressal forum. First one is summoning. Summoning is nothing but sending a summons from the court to the person, asking to be coming as an evidence or a witness. And examining the witness also under the oath will be done under this forum. Discovery and production of any document or material as an evidence. Receipt of affidavits regarding any case can be also asked by the redressal forum. Requesting the report of concerned analysis or test from the lab, issuing commission for witness examination, or any other matter related to. Everything like a mini court, this can function. Next one is appeal. You got an appeal from a district forum, but you are not satisfied. You can go to the higher one called state commission. Still not satisfied, you can go to the National Commission. Still not satisfied, you can go to the Supreme Court. So the time limit is, once you have given, you have got a decision from the district forum, within 30 days of the decision, you have to go to the next one. Otherwise, whatever you have got from the district forum will be considered as the final. The complaint filed within 2 years, any complaint you are going to file against, the patient is going to file a complaint against you, then it should be filed within 2 years of the cause of action. Process is like the complainant. Here, patient will be the complainant. They file a written complaint. The forum will admit it. The redressal forum will admit the complaint. They give a written notice to the opposite party, say the doctor's party, to give in writing what has happened actually. That also should happen within 30 days. And then scrutiny will be done, as affidavit filling will be there, or as interrogation. Personally, they will be called and interrogations will be done. And then judicial decisions will be given as per different punishments. Now, consumer protection councils, for this we have 2 councils at central and state level. Objectives are right to be protected. Patient has the right to be protected against marketing of services which are hazardous to life. He should be informed about the quality, quantity, potency, purity, standards of services, and also protection against unfair trade practices. He should be assured access to variety of services at competitive prices. If a diagnostic technique is available for him at a lower price, which may be suitable for him, you are not supposed to write something high where you are going to get a compensation or a commission from them. No, don't do that. Next one is, he has the right to be heard of what his interests are. Next is seek redressal against unfair trade practices, and then consumer education. All these are guarded by the councils. Now we will see what, being a doctor, how will you safeguard yourself from these kind of actions. First one is, always mention on the prescription what your qualifications. You being the doctor there, imagine in that case, what your qualifications are, what your scholarship, training, whatever awards you have received, then date and time of consultation, age and other particulars of the patient. If it is a complicated case, you have to record the history very precisely, and also the physical findings also should be prescribed or taken care of, noted down very clearly. If the patient refuses to do a lab treatment, or the history that he is going to give you is not reliable, you have to note it down that this kind of thing he has mentioned, he is not ready to do the blood investigation, and written refusal should be there along with the witness should be there. Here, then next is, you are supposed to avoid any vague terminology in the prescription sheet. Record a history of allergy, because even sometimes your diagnostic procedures or your treatment can itself trigger the allergy, leading to hampering his life. You are also supposed to write the correct dosage. After explaining the prognosis, example, you have said the patient that, okay, this is your condition, this is the expected level of your curability. You are supposed to inform and then take the sign of the patient. Mention reasons of deviation from. If you are not providing this particular standard of care, why you are not going to this, why this service is not accessible for him, is to be made understood to the patient, and also taken a note in prescription sheet. Follow-up schedule is to be mentioned. If the patient is under the effect of alcohol, you need to mention that also inside. A particular drug or equipment is not available, because of which you have shifted the treatment, then nobody should come and question you tomorrow, why, when this thing was available, you did not prescribe this. You can mention at the time of consultation. Where to contact in case of your non-availability or in case of emergency. Keep updating. The next important thing is, being doctors, you have the right to update your knowledge and also discuss the case with colleagues. In Ayurveda, we have mention of Tarka, Jalpa, Vittanda, Tadvidya Sambhasha, all. Utilize all those. So why do you think all these kind of records are taken with due consideration and much seriously? Because these can serve as evidences which may help you come out of a case positively. Next one is, what are the don'ts which you are not supposed to do? Examine, like you being a doctor, you itself are sick, exhausted, or you are under the effect of alcohol. Don't go to examine the patient. Never criticize your colleague despite you don't like your colleague. Don't go to criticize in front of your patients, especially. Set aside the queries of patients politely. Like sometimes they will be coming and just like taunting you. This doctor has said me. Why don't you prescribe me these kind of things? Or is that doctor better than you? All these kind. Just ignore it politely. If you are going to adopt any experimental method, don't go for that. But if it is a part of research or something, then you do it only after taking the informed consent. So we'll see what the advantages are. Doctors will always be accountable for act of commission or omission, which we have already seen in case of medical negligence. And also another advantage is that if we have something as this thing, we get speedy justice to the consumers and fair decisions will be made. You can go for appeal in the higher centers also, higher authorities also. And this also encourages proper communication with the patients, proper documentation, better performance, and reasonable charges. Everything will be done pakka. Now we will see what the disadvantages are. Medical services will be every time personalized. You cannot set a standard. Okay, this is the Jwara patient going to come to you. These and these are the tests I will be doing. Only these are supposed to be. No, never. So sometimes there can be unnecessary complaints arising against you. If you are using a defensive medicine practice, more tests may be needed and more opinions will be needed. So in that kind of cases also, it is a disadvantage. You are suable there where you will be having the burden of proof will be on you, and you will be taking it much more time in order to prove your innocence there. Blackmailing by the patient's colleagues, lawyers, and social workers may happen. And also being a doctor, because likely to damage your reputation if a patient goes and complains against you. And the doctor may refuse to take up complicated cases if this kind of things is continuing. Yes, that is for sure. If such a forum is there which does not hear your problems, surely you will be like, you won't be like willing to take any future complicated cases. So that end the final topic of 15th syllabus point called Consumer Protection Act. I hope you have understood my class. If there are any doubts, please you can ask me or contact the committee members, and then you can bring those questions to me. So thank you. I thank PANCHAJANYA for providing me this opportunity for my second class. Looking forward to more opportunities like this. Thank you. Shall I end the session?
Thank you.
Am I audible?
If there are any doubts and queries, it will be forwarded to ma'am and we'll make sure it will be sorted.
Thank you.